Hello, my name is Amanda Koenig, and today I will be talking about how reduced protein expression and loss of function underlie increased cancer incidence in patients with the L16RP16, a mutation associated with familial pancreatic cancer and melanoma. Kindred studies suggest that approximately 10% of pancreatic cancers have a hereditary component, although in most cases, a specific genetic alteration has not been defined in familial pancreatic cancer. We were able to identify several families with high rates of pancreatic cancer and melanoma, as long as high occurrence of a germline missense variant of P16, which I will refer to as the L16R mutation throughout this presentation. This mutation is suspected to be linked to high cancer rates. Molecular modeling was performed, and it predicted that the L16R mutation prevents normal protein folding, which inactivates P16. When P16 is active, it binds to CDK4, preventing it from binding to the CCND1, which then is unable to phosphorylate RB, which causes cell cycle arrest in G1. When P16 is inactivated, it is unable to bind to CDK4, which then is able to bind to CCND1. This complex is then able to phosphorylate RB, which leads to cell cycle progression continuing. When we heterologously express the L16R mutation in pancreatic cancer cells, they were unable to cause cell cycle arrest, as shown in the cell cycle analysis in A. They were also exhibiting lower protein expression, as shown as the Western blots and the analysis in B. Furthermore, they're deficient in binding to CDK4 and CDK6, as shown in the Western blot in C. We also isolated viable dermal fibroblasts from P16, wild-type and L16R members of the aforementioned kindreds to test the impact of the L16R mutation when expressed endogenously. In culture, the L16R fibroblasts grew faster and survived to later passages than the wild-type fibroblasts, as shown in A and the analysis in B. Furthermore, Western blotting of fibroblasts demonstrated that L16R individuals express P16 protein at lower levels than the wild-type fibroblasts, as shown in the Western blot in C and analysis in D. In conclusion, the L16R mutation leads to misfolding of the P16 protein, which decreases the ability of P16 to bind to CDK4 and CDK6, therefore inhibiting the ability to cause cell cycle arrest. Additionally, the P16 protein expression is lowered. Furthermore, the L16R mutation causes increased risk of pancreatic cancer and melanoma in families with this mutation. I'd like to acknowledge that this work was supported by the listed NCI grant as well as Mayo Clinic. I would like to thank my mentor, Dr. Fernanda Zapico, as well as my colleagues for their contributions. Thank you for your time.